Currently around the globe, millions of women go without education, proper healthcare, and sometimes basic human rights. As the need for proper healthcare education are overlooked for these women, the cycle of poverty continues. However, there is a way to stop the cycle by empowering civil rights and improving healthcare, and more importantly, educating young women and girls. The beneficial repercussions of educating women and young girls today. Today, male children in poverty-stricken regions are prized higher than daughters. So when given the chance to either send a son or daughter to school, it is most often the son. As male children will stay with the family, and girls are sent to live with her in-laws after marriage, educating girls is not seen as a return investment. This is accounted for 54% of Indian women, 43% of Southern Asian women, and only 11% of African women being literate. In Africa, when a family can no longer support itself due to HIV/AIDS, young women will drop out of school and help bring in income to care for their families. These women, after dropping out of school, have no skills, disabling them from most jobs, and many turn to prostitution, which puts them more at risk for disease. Studies have long concluded that better educated girls are statistically less vulnerable to HIV, have healthier babies, have less children, live longer, and promote economic growth. With better educated women are better skilled for higher jobs, leading to higher family income. Today, HIV and AIDS epidemic is tearing through sub-Saharan Africa, the world's poorest continent. Out of the 35 to 42 million AIDS sufferers, 25.5 million are African. Out of those world's AIDS sufferers, 58% are African women. This is due to high percentages of rape occurring, not promiscuity. In fact, African women report the same average, if not less, average sexual partners than Americans. It is actually a woman's highest chance of contracting HIV is from her husband, as condoms are sparsely used after marriage. The ever-increasing HIV and AIDS epidemic has led to the current 11 million orphans in sub-Saharan Africa, which is estimated to grow to 20 million by 2016. But the fact that 2 out of 3 African families will be hit by HIV, losing 80% of their income, parts of Africa will just dive deeper into poverty. But it's not just disease that is resulting in high mortality rates in women. Severe lack of health care for one of the most fatal conditions for women is pregnancy. A woman in Sudan has a 1 in 20 chance of dying from pregnancy. In much of the world, the most dangerous thing a woman can do is become pregnant. This high level of maternal mortality or death from childbirth is easily prevented for the most basic health care. The immediate cause of death may be from eclampsia, hemorrhage, malaria, abortion complications, obstruction of labor, or even sepsis. It is estimated a woman in the world dies from childbirth every minute. This is due to several factors such as biology, lack of schooling, and lack of rural health care. However, in countries such as Sri Lanka, where education for girls has been a priority, literacy has risen to 89%, as well as the average life expectancy for women. In recent years, Sri Lanka has brought their maternal mortality rate down from 550 deaths for every 100,000 births to just 58. That comes down to only 1 in 850 chance of a woman dying of pregnancy or childbirth in her lifetime, which is very low considering Sri Lanka ranks 117th in the world's per capita income. This dramatic turnaround has come about not by increasing money, but by increasing better health care and education. With better health care, women are better able to survive childbirth, but has also been shown to lower her chance of contracting HIV. It is not just AIDS and childbirth that has improved, however. Other survivable diseases such as malaria, dysentery, worms, and diarrhea have also improved. Last year, in 2003, 6 million children died, which is terrible, but it is the lowest number on record. To say that places like Africa and India and Southern Asia will always be poor is grossly incorrect. In fact, in the last 5 years, 7 out of the 10 fastest growing economies in Africa were in Africa. In Botswana, the average income in 1960, accounting for inflation, was $383 annually per person. Now that number is up to $12,000 per person annually. India's income has quadrupled. Today, only 0.8% of America's money goes to foreign aid, and it's working. It's helping to improve healthcare and lives. 25 years ago, there were 350,000 new cases of polio a year. Today, we've brought that number down to 400. Measles, malaria, and TB have also seen significant drops. Statistics show that healthier kids go to school, resulting in higher chances of higher education. Some believe that outsourcing American companies to these countries could boost their economic standing. However, countries such as Sri Lanka have proven educating, not throwing money at the problem, as a benefit in the long run rather than the short-term solution. Also, by simply outsourcing companies overseas may help to create jobs, but it lacks to help these countries stand independently and expand their economic standing. Helping these women to improve their domestic life, healthcare, education will not only have greatly improved the current situation of these regions, but will have a ripple effect for the future. As the lives of women improve now, their children and grandchildren will better be able to care for families and better be able to contribute to the rest of the world. The impact of this will inevitably save lives of countless women across the globe. Empowering civil rights, improving healthcare, and most importantly, educating women and girls will help end the cycle of poverty. Any questions?